Hello, Conceal Coalition family. Austin Davis, your National Director of Training, and I am very glad to spend time with you this month on a topic that I think is not discussed enough amongst the 2A community or just your average citizen, whether they're into guns or not. And that is bleeding control and trauma care. Now, whether you carry a gun for protection, whether you have one in the home for protection, whether you're around guns, anytime we spend time around an object that can put holes in people, we need to know how to patch holes in people. Also, if we're ever in a defensive gun use, it's probably going to be two-way range, means bullets are coming and going. And if we shoot our bad guy and our bad guy shoots us, or somebody we love and care about, and we can't patch that hole and we or they bleed out, we lost that gunfight. And even if you never ever plan on getting near a gun, this comes in handy in car crashes, power tools, or any accident. Because when you think about it, the mechanism of death from most injuries is going to be blood loss. It's not infection. It's not the broken bone. It is going to be hemorrhage control. Now, full disclosure, I am not a medical doctor. I'm not a nurse. And I'm not a paramedic. But I have been teaching this thing since about 2015. I'm a Department of Defense Stop the Bleed instructor. I'm an alert first responder medical instructor, and I'm also an alert civilian response and casualty care instructor. I also am the originator and inventor of the Beyond the Bleeding program, which is very similar to Stop the Bleed, except the problem with Stop the Bleed, it just says, if we have this, do this. I find Beyond the Bleeding is a lot more comprehensive because it teaches you a treatment protocol, it teaches you how to move somebody so you don't injure yourself or the responders or the victim, direct, indirect threat care, all the things you need to know to get through a program. Now, the problem with this class today is this is usually something that takes me a minimum of 2 hours for just a basic Stop the Bleed, or an 8-hour course if I'm doing an alert class, because we have to have time for the scenarios, with the officers, the civilians, or Beyond the Bleed class is about a 6-hour course. So we're going to really condense this down. Please do not think that this is a substitute for you to come to a full-time class that involves scenario, high fidelity, realistic scenario-based training. I'm going to break my class down into 3 parts today. The first part's going to be about gear. Second part's going to be about treatment protocol. And the third thing is going to be about incorporating this into high fidelity training. So let's get started. If we're ever in a situation where there is traumatic injury and we need to do something to help these people, before we even discuss the gear, please understand there's nothing we can do in a trauma-based situation that can make the patient better. I'll repeat that, it's really important. There's nothing we can do to make the patient better. There's a lot of things we can do to stop the clock or slow down that death clock and try to get them to treatment, because usually the only way we're going to get them really to get better is on a surgical table or that next level of care. So all we're doing is trying to pause this thing. Now, we talk about what we need to have in our trauma kit. First off, your trauma kit could be something like an ankle kit. It could be something like my big patrol range bag here. It could be my favorite way to keep things, especially around the house, is a double Ziploc bag full of stuff. And if you're a police officer and watching this, my heart goes out to you. This pouch right here in my vest is nothing but trauma gear. Remember, if it's not honest when the party starts, it's probably not going to be any good. So we have to find some way for this gear we're about to talk about that can be on hand when you need it. Because I like to think of gunfights and trauma care as come as you are parties. And to give you a kind of an analogy, a lot of my officers say, well, Lieutenant, I don't really carry my gear on me because it's in my patrol bag in my car. Well, if I'm hunkered down behind a tree trying to hold on direct pressure to you, where I can't get clear because the scene is not safe yet to get back to the car, or what if I said another officer go run and grab my trauma bag, come on back to get to my car, my police car, and they realize I still got the keys or they got the keys, they can't get in. Plus, how long does it take to go and get that bag and get back when time is life? You can bleed out in 90 seconds, 2 minutes quite easily. So we need to have the gear on us and in a reasonable format. Now, we talk about trauma gear. The first thing I always talk about is a tourniquet. I am very pro tourniquet. The thing about tourniquets, though, is it only will help you if that bleeding is from an extremity. That is fairly common for bleeding to be stopped with a tourniquet. The only problem is that's only the extremities. Also, a lot of my officers, a lot of my civilians, a lot of my range safety instructors only carry a tourniquet. for me, a tourniquet is helpful, but it's not really very helpful. The reason is it's probably going to take 2 tourniquets for a limb. There's a good chance that if I had one penetrating trauma, whether it's a bullet or a chainsaw accident or run over by a car, falling off a ladder and having a compound fracture that snaps a primary vessel, I may have more than one limb. So more than one tourniquet. For me, at least 2 tourniquets. Now, when it comes time for tourniquets, there's really 2 I trust. I trust the soft T and I trust the cat. The soft T folds up in a much smaller compact package. It has a metal windlass, it has metal hardware. There's a lot of good things about it. I think the soft T, though, is a little hard to self-apply one-handed if you have to self-aid. I think the cat is a lot easier. I also think this is the most effective tourniquet available at this time. The problem is with the little windlass part here and the windlass retention clips, it becomes kind of bulky to kind of stack on down. So either one of these will work. Make sure that whatever tourniquet you decide to use, there's a lot of others out there other than the soft T and the cat. Make sure they're approved by the Committee for Tactical Combat Casualty Care, the TCCC. If the TCCC, which is a military and law enforcement advisement body that talks about equipment, protocol, and keeps statistics on how to save people in trauma care, doesn't approve it, I wouldn't use it. That doesn't mean it doesn't work. It just means it hasn't been tested by those people. So you really can't run with those 2. If you only take one thing away from my tourniquet chat here, though, please take this away. Do not, I'll repeat that, do not buy your tourniquet off Amazon. The chances are excellent you will get a counterfeit tourniquet. The counterfeit tourniquet will not apply properly as a quality original North American Rescue cat or a soft T tourniquet. Buy them directly from the manufacturers where you know the source. Also, while we're on this, there's some other tourniquets you may want to look at, like the snake tourniquet, which is real thin. It's not combat casualty approved. I can't find that if I put this on somebody, I can get enough circumferential pressure to stop the bleeding downstream. So while it's tempting to say, yes, this is a very small, thin tourniquet, yeah, the problem is I'm not convinced it's going to do the trick. SWAT T tourniquet, which is sort of what happens when a rubber band and ace bandage get together and have a love child. This is not really an effective stop the bleed tourniquet. Now, I do carry one of these, though, in my big kits because there's a lot of things you can do to wrap down and use this as a compression bandage and stuff. But the takeaway from this is, number 1, do not buy your tourniquets off of Amazon. Number 2, buy them from a quality manufacturer. Number 3, at least 2 tourniquets. And you'll notice these 2 tourniquets are colored blue. These are designated training tourniquets. You don't really want to practice with your mainline gear. There's only so much life in any of these things. But if you spend the extra $25, $30 for a practice tourniquet, you can keep it near your television while you're chilling in Netflix. You can practice putting on yourself single-handed on both arms and both legs. And the reason you want to be able to self-aid is because if you do get injured in one of your arms, you still need to be able to put it on. I wish I could spend more time with tourniquets, and you really do need a class and hands-on training, but also you need scenario-based training. As an alert, advanced law enforcement rapid response training instructor, it's the gold standard for active shooter for law enforcement. I hold 7 of those credentials, maybe 8, depending on how you count them. What I find is we can put our officers through those classes and get them to put the tourniquets on, practice at the breaks the whole bit. But when I put them in a realistic scenario, we have predictable meltdowns in how they get the tourniquet on. And remember, when you put a tourniquet on, it's got to be put on the right location. It's got to be put on the right tension. And if the windlass is not turned, there is no tourniquet application. And when you're forced to be in a situation where you see enough blood where you think, man, that's a lot of blood, probably time to put on a tourniquet. It's the quality and the quickness of your actions will determine how effective that tourniquet is. So have a tourniquet, make sure it's not a counterfeit, carry at least 2, and understand just owning a tourniquet doesn't help if you don't know how to use it. Also, it only helps in extremity wounds. Now, if we have a situation where we have a chest wound or a penetrating wound, which is in the shoulders, the buttocks, the neck, we're going to have to pack that wound. Here's a lot of y'all start perking up and go, yeah, that's that combat cause, that quick clot, or the C-locks. They're all excellent. My thought is I have personally not read any studies that say, while this helps clot, and it's embedded in the gauze. And I do think these are wonderful, but I have not seen any studies that says this helps survivability. This little package is about $45, $55. It's the exact same thing as this folded gauze from North American Rescue, which is about $1.75 to $2.25. Now, having said that, if you look inside my professional kit for the range, my patrol kit, what I've got in the home that I keep, what I keep in my vehicle, what's in my vest, it's this right here. The problem is, though, is if you've never opened one of these packages, you don't know how they come on out, you haven't practiced in packing, I'd much rather have you get $20 worth of these, have 10 of these, and burn off 5 of them in packing. Also, you may find when it comes time to pack a wound to try to get enough pressure in there, you may be shocked at how much gauze it takes to pack in a wound. If you have an entry and exit, you may have to pack it on both sides. So again, this is the gold standard, the hemostatic agent in the gauze. The problem is you're probably never going to open one of these, don't know how it's packed in. I'm much bigger than this. And if you have a limited budget, this will get you a long way in life. Now, whether it is a junctional area where we can't get a tourniquet on it, we have to pack the wound, or whether it's a tourniquet, which is an extremity wound, which we can use one, either way, we're going to have to cut probably some clothing because it's very difficult to treat what we cannot see. The problem is many of you will go on Amazon and buy the cheapest pair of foreign-born trauma shears. Now, if this is all you've got, that'll work. But let me tell you, this is about 10, 12, 14 bucks. These are X shears. Now, you can get these off Amazon. These will cut through anything. I can cut through a duty belt to get to somebody. I can cut through just about anything. And at about $35, these X shears will do the job. If size is a little problem, North American Rescue makes a very compact pair of trauma shears, which allow you to get to a pair of pants legs or whatever. Depending on your hand size, though, these are not as easy to use, especially under stress. But you can also, if size is a problem, you can go with a pair of Leatherman shears. These fold down. They have cloth cutters on them. They also have glass breaks. You can get into a vehicle or get out of a situation. There's a lot of upside to them. They also come with a clip, so you can just clip in your pocket. And again, once you fold them on down, they fold down into a very compact little package, which allows you to have a set of trauma shears in a situation where you may be able to carry them any other way. And remember, if you don't have a set of trauma shears, a lot of you are saying, well, I carry my knife. They're flailing around. You're trying to get some clothing. You may end up with a bleed and a stabbing that you've got to fix. So we have tourniquets, we have chest seals, we have trauma shears. What else do we need in this kit? Well, a couple things that are really helpful. I'm a really big fan of carrying gloves with you. I don't necessarily want to share pathogens. Now, if it's my wife, if it's my son, if it's my brother, I'm probably going to take time to glove on up. But if I'm working in a situation where I don't know what kind of blood pathogen they got, I don't want to sit there and share greeblies with them. So that's why I carry gloves. Some things about gloves. I have a really big hand. So really is an extra large size glove is what I need. I almost have to go to 2X to be able to get into them. So whatever size glove you wear, you might want to get one size bigger. Whatever you lose in dexterity, you're going to gain the ability to get the darn thing on, because in a crisis, you're trying to put 5 things into 5 holes, and this becomes a little bit like a Rubik's Cube when you're all freaked out. A lot of you will be tempted to use black gloves because they're more tactical. The problem is one of the things we have to do in treatment is if we don't see the source of bleeding, we have to do a blood sweep on the patient. And look, I find if I have black gloves, I can't see if I've got blood on me or not. So my blood sweep is going to be very difficult to sort out. That's why I like blue gloves. They cost very little. They take up very little room. So if you only have 2 gloves and you tear one, that could be a problem. You may be in a situation you want a double bag, or you may have somebody else who want to help you. So carry more gloves than you think you need. A couple of the things I think are really this is touted as important, but I'm not so sure, which could be a chest seal. The theory is if we have a penetration there, we want to slap a chest seal on. The problem I've got is I'm not sure that I've ever seen a study that shows that aids in survivability. And if I see a sucking chest wound and they're still able to breathe, and I occlude that, I may end up with a tension pneumothorax, which is really likely to kill them. So if your protocol and your training says you need a chest seal, to seal a penetrating chest wound. Hyphen makes a nice vented one. There's other ones that are really good. They're not that expensive. They don't take up that much room. For me, if you've got a penetrating chest seal, I'm going to treat it with gasoline, diesel, or aviation fuel. I'm putting it in my vehicle and I'm taking it to next level of care. I'm getting an ambulance there, a box. It's diesel. We're taking it, or we're getting a helicopter and we're flying it out of there. There may be some application for this. Right now, it's my understanding from people who are true emergency trauma professionals that this may or may not be an asset. I would still carry one in my kit, but I think twice before using them, especially if it's outside your care. One of the things we're going to need to do is we have to make sure that our patient does not go into shock. So I carry a space blanket. This is my favorite. It's made by SOL. It is the XL size. The problem is a lot of times we put a space blanket in a kit. You've never opened it because it's all in there and folding it back up is kind of a chore. The problem is they're about 4 feet by 5 feet. And you really can't wrap somebody up. If I'm dealing with somebody who has got a lot of blood loss, hypothermia can kill them. If their blood temperature gets below a certain level, the blood doesn't want to clot. So I want to keep them as warm as possible. The only problem with a space blanket, a Mylar blanket, is yes, it helps retain body heat. But if their body temperature gets below a certain point, they're not generating enough heat to make it. So what I have in all my kits is I have these hand warmers. You can pull them out, flip them, put them in their armpit, put them in their groin, put them in a socket if it feels like it's too hot for them, but I can help them generate heat inside the space blanket. Hand warmers don't take much, and as we're going to find out in the treatment protocol, if they get cold, we have a real quick path for them to go into shock. So we want to keep them as warm, as comfortable as possible. So we've got our gear. We found a way to carry it that works for us. And if you want to just carry 2 tourniquets, some chest material, some gloves, and some shears, and you're probably going to be way ahead of that. If you carry it in a purse, a backpack, a fanny pack, something that's close to you when the accident happens, or if you want to put an ankle kit on you, or if you have cargo pockets, drop it in there. You never know when you're going to need this. I keep a kit by my bedside, keep a kit in my range bag, my patrol bag, and my vehicle. And if you know somebody who goes out hunting this time of year, make sure they take a trauma kit with them. If you have friends that work on their farm or their ranch and they're a long way from the house or communications, make sure it's in the tractor, it's on the mule, whatever vehicle they're using to get around in. Because this gear is not expensive, it's not heavy, it's not bulky. You can kind of work around it a little bit. The problem I've got though is if this is the only tools you have, you need them handy because, again, think of any trauma situations that come as you are a vet. Now, once you have your gear and you're exposed to some sort of trauma situation, your mind, without training and a protocol, is going to kind of go, oh, I don't know what to do. And one of the things I like to talk about is if you ever catch on fire, you have been trained as a small child to stop, drop, and roll. And if you're on fire, stop, drop, and roll may come to your head. And if you're old like me and there's some sort of nuclear thing coming in, you get underneath your desk and duck and cover, duck and cover. Of course, I'm old. When I was a kid, the desks were made out of wood and steel. Now they're plastic. So I don't know how much duck and cover still relates to it. There's a treatment protocol, though, I think that's really helpful. I've been teaching since 2015. I stole it from another guy who wrote a great book on the topic. It doesn't come to me right now, but if you have any doubts about it, I'll give it to you. It's STOP. If you're ever in a situation that involves trauma care, think STOP, stop. First thing is security, scene security. There's direct threat care and there's indirect threat care. If you pull up on a motorcycle accident and there's a compound fracture and blood squirting out, and you got your kit in your hand and it's late at night and it's around a curb and you start treating them right there in the street, you both may get hit by another vehicle coming on. If we're in an active shooter situation and we're at a Las Vegas concert and all of a sudden someone from a elevated spot starts shooting us and you think, wow, I've got my ankle kit on me, I'm going to start treating Austin, you're probably going to get shot right next to me. So what I want you to think about is maybe I'll pull them behind a building or some sort of cover, then start my treatment. We do not do direct care on the X. We move the patient as best we can. Now, I don't have time in this talk to talk to you about how to move a patient because moving a patient is a very important skill to have for 2 reasons. One, we don't want to hurt the patient when we move them. Second off, I don't want you moving somebody really big and then throwing out your either your shoulder joints hurting your back. And then now I've got two incapacitated people I've got to deal with in a direct threat care. So get some training on how to move a patient effectively and use the large muscles of your body in the different ways you have to move them depending on what orientation they are between you and where you want to drag them. So first thing is security. Take a beat and look around and figure out, is this a safe place to treat, or do you need to move them from a direct threat to an indirect threat care? And this is also a really great time to go, what are my threats? What are my risks? And what's the situation here before you start treatment? So STOP, first thing, security. Make sure the scene is secure before you start treating them. And remember, risk a lot to save a lot, risk a little to save a little, risk nothing to save nothing. Next thing is of the STOP is T, treat the bleeding. If it's an extremity wound and you see enough blood to make you think, wow, that's a lot of blood. Now that blood could be pulsing out. It could be just enough blood on the floor to make you think, oh my gosh, that person lost a lot of blood. Slap that tourniquet on. Now, the instructions are usually 2 to 3 inches above the wound with the tourniquet, not over a joint. But if you're in a dramatic situation and you're not real sure, just remember this, go high or die. Put it up as high as you can. Make sure that it stays perpendicular to the limb because you're not putting the tourniquet in this kind of an angle here because it's going to pop off. Also, when you try to put one on the leg, go as high as you can. Get underneath the leg, seesaw it so it doesn't curl up underneath the limb. If they have something in their pockets and you have time to get it out of their pockets, run your trauma scissors down, pull the material out the pocket, and then go crank down on the tourniquet. You'll know the tourniquet is tight enough when the bleeding stops. If you get it as tight as you can, you may have it in the wrong place, the wrong tension. You haven't used the windlass, or you might need another tourniquet. That's why we always have to have at least more than one tourniquet. We also can treat the bleeding by packing the wound. And packing the wound is a very specific skill set. We can't cover it here. But trust me, if you've never done it, it's going to take more gauze than you think. You got to go all the way down to the base of that. You have to figure out if you're going to blind pack or if you're going to focus pack. If you can reach in and you can feel where the blood's spurting or pulsing, put direct pressure on it, get the gauze in, pack more than you think, hold on down, hold direct pressure. If you have a pressure bandage, or you can use the SWAT T, create some tension on that. Tourniquets and packing a wound are important skills. I think the more important skill, and something I really can't teach you in a webinar though, is direct pressure. The reason I like direct pressure is I may not be able to carry enough gear on me all the time. I may be at some formal event where some shooting happens that I don't have access to my gear. I may have more victims than I've got equipment. So if you know how to put direct pressure on the brachiofemoral artery and get pressure on it, you can also call someone over and say, you, come here, put pressure right here. You'll know you're using direct pressure to stop the bleeding well enough when the bleeding stops. If the bleeding's not stopping, you're in the wrong place, the wrong pressure, or you're in the right place without enough pressure. So you need to go ahead and Google and spend some time and figure out where exactly those blood vessels run down the body. What's interesting is once you start getting really good at this, it takes very little pressure for the upper arm to stop a bleeding. On the leg, though, depending on how muscular the victim is, how much adipose tissue, how fat they are, it can be very difficult to find that spot to get direct pressure. The great thing about direct pressure is it only takes 2 hands, or in some cases you can use a knee. The problem is with direct pressure, though, is while you always have the tools with you, you are now stuck with that patient. And it's really difficult for you to try to stop more than one bleed. So if you have the gear, great. If not, direct pressure. So first thing you want to do is we want to secure the situation. Next thing you want to treat the bleeding. The problem with the bleeding is once the blood leaves the body, we can't put it back in. If they're not breathing, I can put more air until we can get this thing working again. But the blood, once it comes out, there's no way to replace it. So we want to keep every drop possible in there. And I can't tell you at what point in blood loss things start going shocky and we get past the point where we lost so much blood, we have a cascading effect. And even if they were in an operating suite, they may not survive. So my advice in this is if you see blood pooling blood's clotting, you see blood spurting, or if your brain says, my gosh, this is an awful lot of blood, it's time to get very aggressive in treating the bleeding. So secure the scene, treat the bleeding. Treat the bleeding 1 of 3 ways: direct pressure, tourniquet, or packing the wound. O stands for open the airway. Make sure they can breathe. One of the easiest things to do is after you get the bleeding done, if they're having some problems, or if it's some sort of traumatic chest injury, you have a couple options. One is if you think a chest seal will solve this problem, that's great. For me, anything between the the notch here and the belly button. This is a major thing. We want to get gasoline, diesel, aviation fuel. We give the next level of care. If the patient's having a hard time breathing, do not try to force them in a position they're still conscious. Let them sit up and move around and find exactly what works for them. You might find that if they have some sort of facial injury, that sometimes just hanging down, like grabbing and letting the blood and the fluids flow out of there might be kind of helpful. If you've secured the patient is no longer actively breathing, but they're unconscious, you can put them in what's called a rescue position. You fold them over on their side. And the great thing about a rescue position is if they do vomit, they do have any fluids, gravity is going to take care of that. Also, if we're in a mass casualty situation, any of the follow-on responders can look and they'll see somebody in a rescue position. They know somebody's addressed them to some point and they can move on if they have to, or they know that that person's at least been minimally assessed. And the final thing is prevent shock. The number one way that people go into shock with a large amount of blood loss is to get hypothermic. So at that point in time, make sure that they're not lying in wet carpet or on their own blood or on bare concrete, an air-conditioned situation. So you may want to move them off any of the fluids. You run a real risk if you try to remove some of their clothing, because that may cause more body loss to come on out. But if you have some dry clothing, maybe that's worth switching that out for. Putting other clothing and other layers of insulation around them. If you have some heat packs that underneath the arms and the groin, the armpit, that can really help maintain them. One of the other keys to preventing shock is calming the situation down. One thing you remember about preventing shock is calm is contagious. So I need you to control yourself, control the patient's fear, and try to calm anybody around you who's freaking out and screaming, because they're not helpful. And if the witnesses are out of control, give them a job. You call 911. You go to the front door and get ready for the ambulance. One of the things I like doing is I carry a set of gloves that are wanded up. So if somebody really freaking out, take it, throw it at them, hit them in the chest and say, glove up. Because now you have somebody who's trying to put 5 fingers and 5 holes in 5 gloves. It's not that you need them, but if you tell them to glove up, it gets them out of your way. I think of it as sort of a latex Valium, and it's worked real well for me as a police officer before. But the key to keeping them calm also is touch. Now, I don't mean giving them a back massage. Hand on shoulder, hand on their elbow. Hey, you're doing great. I'm not going to leave you. Start getting them future-based. Once we get you the next level of care, who do we need to have we call? Who do I need to call for you? Do you have any known allergies? Just try to get them focused on what's going on and try to get them to control their breathing and their arousal levels to come on down. Now, you got a perfect kit, or at least a kit that works for you, that covers most things. You understand your protocol, STOP, secure the situation, treat the bleeding, keep an open airway, and prevent shock. What about training? In my world, it's a little like if you go to a range and all you do is stand in a well-lit, well-controlled environment, shoot a piece of paper that does not move and does not want to kill you. That's great training for standing still in a range and shooting a piece of paper in a well-lit, well-controlled environment that doesn't want to move and doesn't want to kill you. Those are probably not consistent behaviors with you having. That's the lowest cognitive behavior you can have with a gun, and shooting somebody in a gunfight is the highest cognitive behavior. And if we don't train in that high level of cognitive behavior, we're going to find some predictable mistakes when we start putting you into this. Again, I know this because I'm an alert instructor. I spend a large portion of my year teaching other officers how to do this in high fidelity scenarios. And invariably, after we got the simunition battles run, and people are screaming, the alarms are going off, and now they've got to treat the patient. And we have moulage that puts on and makes it look like a real wound. We have different ways to simulate injuries. It's amazing how even something as simple as putting on a tourniquet, which they practice over and over again in this class, may even have been through this training 2-3 times in their career, will still start to break down. I also know this because as the owner and founder of the Virtual Tactical Academy, we have a virtual reality simulator. We travel the country and teach people to shoot in context. I've been using the gunshot wound treatment protocol with the scenarios after the scenario is over, because most people who run a scenario go, bang, I shot him, he's dead. Well, that's great. We don't practice the 911 phone call. We don't practice the trauma care. We don't practice those other secondary activities, which are just as important as surviving the gunfight, initial gunfight, is that you or your loved one bleeds out. We lost the gunfight. So I highly encourage you to seek out some advanced high fidelity scenario training. Now, in closing, I really wish we had at least 2 hours of just a basic stock bleed class. I really wish we had 6 hours to do an alert class with you or beyond the bleeding. or 16 hours if you're in law enforcement to get you through a level 1 or first responder medical course. I don't have that kind of time. Hopefully this will turn into some sort of motivation for you to take this to the next level. It really puzzles me when people find out a police officer and they're gun people, and the first question is, what kind of gun do you carry on duty? What kind of assault? What kind of patrol rifle do you carry? What kind of shotgun? Are you a rifle or shotgun guy? They want to talk about what kind of truck gun do I have? All these things really, I think, are the mark of someone who hasn't really thought about this in depth. One of the classic examples is the recent situation in New Orleans where we had that person mow down a number of victims. Your truck gun, you go get that and come back in to try to solve the situation, you're probably going to get shot by a licensed carrier or law enforcement. If you're in Boston bombing, if you're in the Vegas shooting, your firearm will not help you save lives. What will help you save lives is knowing how to put direct pressure, knowing how to safely move the victim, having a treatment protocol, how to prevent shock. These are how you save lives. And after that truck stopped and that person engaged the law enforcement and then that threat was put down and stopped, we've stopped the killing. The protocol with active shooter is stop the killing, stop the dying, and rapid casualty evac. Because remember, we can't do anything to make them better on scene. We can do a whole lot of things though to pause the time button to buy them time to the next level of care. These victims need a surgical suite. These victims need an emergency room. They need us to buy them time to get there, but we can't make them better. So really and truly think about practicing your gear. Really and truly think about getting a good high quality gear. If you only can afford one kit, put it in a double Ziploc bag like this. It costs no money. You can see what's inside. If you have to treat in a hurry, you have time to glove up, you could pull this bag off and put your hands on this or start working on the page without taking time to glove up. They're dirt cheap. You can see everything in it. You can use a quart-sized bag. You can use a gallon-sized bag. If you can only afford one bag, don't leave this to your car at night. Put this next to your bed. When you go to the range, bring that with you. If you have a workplace and you have a stop the bleed kit, look through that kit. You're probably going to find it has one tourniquet. It has probably very minimal amount of wound packing material. Probably has no chest seals. Maybe one set of gloves, but I'd be real curious to see what size those gloves are. So why am I making a big point about all of this? Well, I've been making a big point about this since 2015. It's a passion of mine. I think more lives get saved by this training than you carrying a firearm. If you carry a firearm, you have a tool that makes holes in people. We didn't know how to patch holes in people. As I said last month in our terrorism thing, I think 2025 is going to bring some really unique challenges to us in the active killer department. Hope I'm wrong. I hope we look back at this next year and go, Austin, what's the need for all this? But if we do, your firearm may be needed, but I guarantee you your medical training will be needed. My wife and I are coming back from lunch on a Saturday afternoon. We're maybe a block and a half from our house around the corner, and there's a vehicle rolled over and a person out of the vehicle. I've got to pull my vehicle over, get my lights on, get the wife to start getting on the phone, call 911, grab my kit and go assessing this thing. This is a Saturday afternoon, Saturday 12:30, 1 o'clock in the afternoon situation to where that kit could have made a big difference. Fortunately, didn't need to use any of the tools, but I could get the victim out of the direct threat area on the non-direct threat area. Fortunately, I had response really quickly because I live in a town by design that has good, effective, well-staffed law enforcement, good, effective medical. They came over, took next level care. But if I'd been in a situation where I'm in a community that doesn't have these kind of resources, and I was stuck there on the side of the road, there was enough stuff in the car for me to treat a bunch of people I had to. I've got the training, and I've got the training in context so that when this was happening, I had a logical order progression. I could keep a total situational awareness. I didn't have to focus on any one skill set. It put me in greater risk of other situations that could be equally as dangerous in a time of crisis. So in closing, if you think as a part of a Concealed Coalition family, we need to have more of this training, please write in and let us know. If we need to come to your community and do one of these, let me know. If your business needs a Stop the Bleed class or a Beyond the Bleeding class or an alert class, please let me know. Trust me, my passion is making Americans safer so they can be a guardian always and a warrior when needed.